Lansoprazole, also called by brand names such as Zotone Fast Tabs, Pervisit Capsules, and many other brand names. This drug is available as capsules, tablets, as well as liquid form. Lansoprazole is used as anti-ulcerative because it reduces the amount of acid the stomach makes. It is used to treat indigestion, acid reflux, and gastroesophageal reflux disease. It is also taken to prevent and treat stomach ulcer. Sometimes, lansoprazole is also taken for an uncommon illness caused by a tumor in the pancreas or gut called Zollinger-Ellison syndrome. Presenting lansoprazole in stereochemistry. It is a racemic mixture of equal amounts of two enantiomers with a molecular weight of 369.4 grams per mole and the molecular formula of 16 carbons, 14 hydrogens, 3 fluors and nitrogens, 2 oxygens, and only 1 sulfur. The sulfur, linked with a double bond to an oxygen atom, makes the central chiral of lansoprazole, resulting 2 isomers, S and R. Both isomers are named according to the higher atomic number. The oxygen linked to the sulfur takes number 1, as it has the highest atomic number. The carbon linked to more nitrogens takes number 2. The other carbon is linked to a chain of carbons, so it takes the number 3, while the free electrons take number 4. The order of atoms is anti-clockwise, so the molecule is its isomer of lansoprazole. Same goes for the other molecule. Oxygen takes number 1, carbon linked to more nitrogens takes number 2, and so on. The direction will also be anti-clockwise, but due to a shift in the atom's position, the molecule will be an R isomer. The S isomer, also called levolansoprazole, is less active, prescribed in large doses, and is pretty cheap. While the R isomer, called dexlansoprazole, is active, prescribed in small doses, and is quite expensive. Metabolism. Lansoprazole has a bioavailability of 80% or more, and is 90% bound to plasma proteins. Lansoprazole is extensively metabolized in the liver. 2 metabolites have been identified in measurable quantities in plasma, which are hydroxylated sulfonyl and sulfone derivative of lansoprazole. This drug is thought to be transformed into 2 active species, which work as proton pump inhibitors. In other words, inhibit acid secretion by blocking the proton pump. Elimination. The plasma elimination half-life of lansoprazole is less than 2 hours, while the acid inhibitory effect lasts more than 24 hours. Therefore, the plasma elimination half-life of lansoprazole does not reflect its duration of suppression of gastric acid secretions. Approximately 1/3 of the administered radiation was excreted in the urine, and 2/3 recovered in the feces. Lansoprazole is mostly taken by adults and can also be taken by children when prescribed by a doctor. It is usual to take it once a day in the morning or twice a day in case of severe illness. Depending on the illness, one may only need to take it for a few weeks or months. Sometimes might need to take it for longer, even many years. Some don't need to take lansoprazole every day and take it only when they have symptoms. all according to the need and prescription. Lansoprasole isn't suitable for some people who have allergic reactions or liver problems. It is generally not recommended in pregnancy or while breastfeeding. A medicine called omeprazole is a safe alternative in cases of pregnancy. Drug interactions. Drug interactions may change how medications work or increase the risk for serious side effects. Some products need stomach acid so that the body can absorb them properly. Lansoprasole decreases stomach acid, so it may change how well these products work. Some affected products include ampicillin, atazanavir, nilfinavir, certain azole antifungals, and many other drugs. Mixing lansoprazole with herbal remedies and supplements, such as remedies for depression, reduces the amount of lansoprazole in the blood and makes the medicine less effective. In other words, it may stop lansoprazole from working as well as it should. Lansoprazole works best if you take it 30 minutes before a meal or snack. That's because food slows down the drug getting into the system. Hope you learned and enjoyed. Thanks for watching.